Maheshwara, Guru Sakshat Parabrahma, Tasmai Sri Guruve Namaha. A warm good afternoon to all invitees, faculties, and students who are here. Before we move on to the webinar, let me wish all the teachers present in this platform a very happy Teachers' Day. St.Thomas College Autonomous Thrissur is the oldest Catholic college in Kerala, established as an educational institution in 1889 and was raised to the rank of second grade college in 1919. The Department of Botany was started in 1951 with natural science as an intermediate course and ever since its inception. The department has been initiated with a conservation-oriented module of natural and environmental education. And now, we are here for a 3-day international webinar, Guru Vandanam, organized by the Research and Postgraduate Department of Botany on the topic Frontier Areas in Plant Science for Human Welfare. Nothing is complete without the grace of God. So, let's begin with prayer. I invite Ms. Parvati Emma, Student Coordinator, for prayer.
കാണായ ലോകങ്ങൾ കാക്കുന്ന ദേവാ കാരുണ്യ സിന്ധോ നമിക്കുന്നു ഞങ്ങൾ കരളിന്റെ പൂക്കൾ നിൻ പാദധാരിൽ കാണിക്ക വെച്ചു നമിക്കുന്നു ഞങ്ങൾ ലോകാ സമസ്ത സുഖിനോ ഭവന്തു ഈ മന്ത്രമീ ലോകമെങ്ങും മുഴങ്ങാൻ വിജ്ഞാനദീപം നിറകതിർ ചൂടാൻ കാരുണ്യ സിന്ധോ നമിക്കുന്നു ഞങ്ങൾ കാണായ ലോകങ്ങൾ കാക്കുന്ന ദേവാ കാരുണ്യ സിന്ധോ നമിക്കുന്നു ഞങ്ങൾ.
I invite Dr. Vimala Jose, Head of Department Botany, the backbone and supporter for all the events held in the department, for the welcome address.
Good afternoon and welcome to this Guru Vandanam program, the 3-day international webinar on the frontier areas of plant sciences and human welfare organized by the Department of Botany of St. Thomas College. This is a 3-day program. It is organized to pay homage to our 3 former faculty members who are no longer with us and who have left their heavenly abode. Today, being Teachers' Day, is dedicated to Professor K.M. James, who has left us on this very same day last year. Professor James was a teacher of dedication and hard work, who has nurtured the subject and also his students. Many of his students memorized that the encouragement they received from him, and also was instrumental in shaping their career and achieve the goal in their life. Tomorrow, day 2 is dedicated to Professor C.L. Joseph, an eminent teacher who has guided the students to delve deeper into the subject, physiology and the botany. The Department of Botany, St. Thomas College, is privileged to have Professor E.D. Verghese as a faculty member who will be remembered on day 3, that is day after tomorrow. We also have with us 3 of our eminent alumni, Dr. Ajay Kumar, a professor of IIT Guwahati, who will be addressing us today. Dr. Shivakumar Patatil, scientist of University of Georgia, who will be giving his message or delivering his keynote speech tomorrow. And Dr. Jose T. Puttur, HOD of the Department of Botany, University of Calicut, who will be delivering his speech on day 3. This 3-day webinar series is being inaugurated by Dr. Martin K.A., Principal in charge of St. Thomas College. On behalf of the Department of Botany, I welcome you, Father. I'm happy to welcome Professor P.J. Abraham, former HOD of the Department of Botany, St. Thomas College. Professor P.J. Abraham will be giving his message as a chief guest. I take this opportunity to welcome Dr. E. Josie sir, who will be delivering the remembrance speech of day 1 regarding Professor James sir. Professor Ajay Kumar, our alumnus, will be from professor from IIT Guwahati. He will be delivering his speech on the topic phytochemicals in the prevention and treatment of chronic diseases. Phytochemicals in the prevention and treatment of chronic diseases on the first day. I, on behalf of the Department of Botany, welcome you, dear Ajay sir.
Thank you so much.
I also welcome all the present and former faculty members who are with us, and also our former students who are members of alumni, and all the members of alumni who are joined from all the parts of the world, and also our present students. And wish you all the best. Thank you. Thank you.
Hello, Sanu.
Sanu, you may continue.
Yes, sir.
Sanu?
Now we move on to the inaugural ceremony. For the inauguration, I would like to invite Reverend Dr. Martin K., Principal in charge, St. Thomas College, Autonomous, Thrissur, for the inauguration.
Hello, am I audible?
Yes, Father.
Hello.
Yes, video is not.
Yes, a warm good afternoon to one and all. No, video cannot be played. No? So there is a range problem, and I am already on the field. I come out of the, since it is a botany webinar, no, so I have come out of my room because of range problem. So let me begin. Professor P.J. Abraham, the chief guest of the day, Dr. E. Josie, who is delivering the remembrance speech, Professor Ajay Kumar Kundamkar, other resource person of the day, Dr. Vimala Jose, the HOD, and other dignitaries, delegates, Dr. Ignatius and the former principal, and my dear students, research scholars. So I'm very happy to be a part of this wonderful program called Guru Vandanam. And it's a very right day that you have planned this particular program, and remembering the teachers and sending them some wishes. And normally we finish with that, but exceptionally, on the other hand, the Department of Botany has taken another step forward, not only to remember the great the masters of the Department of Botany. You have organized such a wonderful program called Guru Vandanam, and it is a series of webinars. And as a culmination, you have also planned to have some presentation of papers. So when you remember great teachers like K.M. James and all, it's nice that we conduct a webinar in connection with that, so that our memory is not lost. Our memory has become fruitful. You know? Just like sprouting of a tree or sprouting of a plant, Botany Department has their memories have been meant for sprouting. So it also, just like a tree or a plant, it is bearing fruits. So academic fruits. So I'm very happy to be a part of this program. I take this opportunity to congratulate the Department of Botany, especially the HOD, Dr. Vimala Jose and Dr. PV and other people behind it. and we are having 3 sessions consecutively, starting from today. And our own students who have conquered the major positions in IITs and universities and other parts of the world. We are proud that we have the speakers of our alumni as well. So I'm very glad. And with these words, let this sprouting of academic programs, let us have in plenty, especially from the Department of Botany. We shall remember our great masters, our teachers, and our people who have built up this department from the very beginning of our college. Let me inaugurate this program called Guru Vandanam. Let us have great sessions ahead. Thank you. Thank you so much.
Thank you, Father, for being with us and inaugurating the webinar with a fruitful message. Now, let me invite the chief guest of the day, Professor P.J. Abraham, former head of department, for addressing this seminar.
വിദ്യാർത്ഥി സുഹൃത്തുക്കൾ, സെന്റ് തോമസ് കോളേജ് ബലോന്മുഖമായ 100 വർഷങ്ങൾ പൂർത്തിയാക്കിയിരിക്കുന്നു. സെന്റിനറിയോടനുബന്ധിച്ച് എല്ലാ ചടങ്ങുകളും നടത്തിക്കഴിഞ്ഞു. ഈ പുരോഗതിയുടെ രാജ്യപാതയിലേക്കുള്ള പ്രവേശിക്കുവാനുള്ള ശ്രമമാണ് നടത്തേണ്ടത്. 1919 സ്ഥാപിതമായ സെന്റ് തോമസ് കോളേജിൽ നീണ്ട 32 വർഷങ്ങൾക്ക് ശേഷമാണ് നാച്ചുറൽ സയൻസ് കോഴ്സ് ആരംഭിച്ചത്. അതുകൊണ്ട് ഏറെ വിദ്യാർത്ഥികൾക്ക് ബയോളജിയിൽ ഉന്നത വിദ്യാഭ്യാസം നടത്തുവാൻ സാധിക്കാതെ പോയി. 1946 SSLC പാസ്സായ എനിക്ക് സെന്റ് തോമസിൽ പഠനം നടത്തുവാൻ സാധിച്ചില്ല. 1959 നാച്ചുറൽ സയൻസ് ഇവിടെ തുടങ്ങിയുള്ളൂ. എൻ്റെ സഹപ്രവർത്തകരായ 3 പേർ ചതമം പ്രാപിച്ചു. പ്രൊഫസർ E.D. വർഗീസ്, പ്രൊഫസർ C.L. ജോസ്, പ്രൊഫസർ K.M. ജെയിംസ്. ഇവർ നിത്യതയുടെ മനോഹര തീരം പ്രാപിച്ചു. അവരുടെ ധന്യസ്മരണയ്ക്ക് മുൻപിൽ ഏറെ ആദരവോടെ ഉപാസനകൾ അർപ്പിക്കുന്നു. അവർക്ക് നിത്യശാന്തി നേരുന്നു. ഗുരുവന്ദനത്തോടനുബന്ധിച്ച് ഇപ്രകാരമുള്ള ഒരു ചടങ്ങ് നടത്തുവാൻ ശ്രമിക്കുന്ന സംഘാടകരോട് എൻ്റെ നന്ദിയും സ്നേഹവും അറിയിക്കുന്നു. പ്രായത്തിൽ ഞാൻ മൂപ്പുമുറക്കാരനായിരിക്കുന്നു. 91 പൂമുഖത്തിന്മയിലേക്ക് പ്രവേശിച്ചിരിക്കുന്നു. ദീർഘായുസല്ല ഞാൻ ആഗ്രഹിക്കുന്നത്, അനായാസമായ അന്ത്യമാണ് ആഗ്രഹിക്കുന്നത്. ഈ ചടങ്ങുമായി ബന്ധപ്പെട്ട എല്ലാവർക്കും അനാകുലമായ ക്ഷേമം ആശംസിക്കുന്നു.
Thank you, sir, for joining us on this day and sharing your message for us. Thank you, sir. Now, I invite Dr. E. Jose Joshi, former faculty member, for the remembrance speech. He would be speaking to us about Professor K.M. James.
Good afternoon, my dear colleagues, students, and friends. Commemorating 3 of our esteemed late colleagues, Professor E.D. Varghese, Professor C.L. Jose, and Professor K.M. James, on September 5th, the Teachers' Day, through Guru Vandanam, is a wonderful idea. I really feel proud that our own students are conducting the 3 seminars as a part of the Guru Vandanam celebrations. Professor E.D. Varghese and Professor C.L. Jose were my teachers. And later, I was fortunate to work for 20 years with such scholarly and dedicated teachers. Professor James and myself joined the department during the same academic year and retired together. By nature, James was humble and modest and was very friendly with the students. He worked very hard to have a mastery in all the subjects that he taught. And Professor James took special care for those who were weak in their studies. Very few of his colleagues knew that Professor James financially supported a good number of our students and also in his neighborhood. All these three eminent teachers died empty, as said by Henry Todd. St. Thomas College, Thrissur, as you know, started in 1889 as a first grade college, completed 130 years of existence. And now it is a full-fledged college for more than 100 years. It's still maintaining its leadership and scholarship qualities. Their children are scaling up to eminence. Definitely, UGC has no hesitation in placing the college in the top list of the colleges in India with A grade. Looking back and rekindling the memories of 7 years of my student life and 31 years of teaching in the department, I feel very proud and consider it as a God-given opportunity to study and work under the guidance of such great masters. Regarding the speakers, our own students, all the speakers having been nurtured by our own professors, imbibed great qualities from them. Deep knowledge in the subject, loving and helping attitude, above all, sharing whatever they have gained with the students. Dr. Jose Putu, head of the Department of Botany, University of Calicut, and Dr. Shivakumar, Senior Research Scientist, Georgia University. The department is proud of you. A special welcome to Dr. Ajay, IIT Guwahati, who is today's speaker. I take this opportunity to congratulate Dr. Ajay for his selection to one among the few scientists from all over the world working in the field of cancer. I wish Dr. Ajay all the success in his scientific endeavor. I also wish to congratulate and thank the organizers, especially Reverend Father Dr. Martin K.A., Principal, St. Thomas College, Thrissur, Dr. Vimala, Head of the Department of Botany, and Dr. Anto and other departmental colleagues. Once again, wishing all the success for the program. I thank you all. Thank you.
Thank you, sir, for sharing your memories and addressing us on this day. Now, we move on to the invited speech. Professor Ajay Kumar Kunnamagara is along with us to speak about the topic phytochemicals in prevention and treatment of chronic diseases, what we have learned thus far. He is an alumni of our college who has pursued his UG and PG from our college. He has pursued his Doctor of Philosophy at University of Calicut, working in Amala Research Institute. And he was a former postdoctoral scholar at University of Texas MD Anderson Cancer Center during the period 2005 to 2008. Also has worked at National Cancer Institute of National Institute of Health during 2008 to 2012. And at present, he works as professor at IIT Guwahati. He is one among the world-renowned cancer research scientists. More than that, I would also like to express the gratitude towards you, helping the department to put up a seminar in which you have brought some renowned personalities from different nations, which was a fruitful seminar. Now, I welcome you, sir, for the invited speech.
Thank you. Good afternoon to everybody. So it's a proud moment and a wonderful moment to me to deliver a talk in front of my teachers like John sir, Josie sir, and Ignatius sir, Jacob sir, and so on. There are many of my teachers are here. Actually, I studied my pre-degree in St. Thomas College in 1994 to 1996. And Ignatius sir taught me the botany subject in first and second year. Then I studied my MSc from 1999 to 2001, where John sir taught me embryology and those things, and Josie sir taught me, genetics. Ignatius sir taught me environment science. Jacob sir taught me taxonomy, and so on. And James sir taught me biochemistry, mycology, and that is why I feel that I'm here at present. Okay, so I'm not delaying because I know it is almost 5 o'clock. And we are a little bit late, so I will go to my presentation directly. So my slide is visible?
Yes, sir. Yes.
Yes, right. It's a full view, right?
Yes, yes.
Okay, thank you. So today I'll be talking about phytochemicals and in the prevention and treatment of chronic diseases, what we learned thus far. Before moving, to my old teachers of St. Thomas College and other places, Happy Teachers Day. And I would like to quote this. This is a quote, I got it, and it strikes me a lot. A good teacher is like a candle. It consumes itself to light the ways for others. And that is what my teachers also did. And that is why I'm here at present. And I cannot, miss St. Thomas College or forget St. Thomas College Thrissur, because it is in my heart. I always feel, and I always talk to the people, because I studied in St. Thomas College in my MSc, that is why I got the opportunity for PhD and postdoc and, and in a prestigious position at IIT. So thank you for all my teachers present here and who are not present here also. Second, all of you know that this is the day we are remembering our beloved Professor James sir. And I would like to quote, without you, I would have been lost. Thank you, sir, for always guiding me and inspiring me. I always feel you are with me. So I have a lot of gratitude and thanks to Professor James sir, because he helped me a lot throughout my journey, even after my MSc also. And even, the reason I got PhD admission, it is because of James sir. And even during my PhD also, he helped me a lot and encouraged me and guided me, even during my postdocs. And even after joining at IIT also, he guided me a lot. One day I told him, that was in 2019, so I'm teaching biochemistry, and the inspiration came from you. So anyway, all of you know that he helped me a lot, and he was a very good teacher of biochemistry and other subjects. And we lost him, last year on the same day. Even I feel that many times I feel if he is with me, I would have achieved a lot. But anyway, I hope he's he is in heaven and pouring the blessings on us. So let me start with the institute IIT Guwahati. So IIT Guwahati is the 6th member of IIT fraternity established in 1994. And at present, the institute has 11 departments and 5 interdisciplinary academic centers and 4 schools, which covers the major area of engineering, science, humanities, and offers BTech, BDS, MA, MDS, MTech, MSc, and PhD programs. And this is now 26 years old IIT, and it is located near the Brahmaputra River, banks of Brahmaputra, and it has around 700 acres. So IIT Guwahati is one of the most renowned institute or university in the world at present. According to 2022 21 world ranking, IIT Guwahati is in the 395th position in the world universities. And it is interesting that in the in citations or research, IIT Guwahati is the gains the 41st rank in the world. And in India, in citations, IIT Guwahati is the 2nd position. So I'm very proud to be associated with this institute. So these are some of the pictures of or some of the photos of our institute. So I would like to invite you, all of you here to IIT Guwahati. If you happen to be in Northeast, please give me a call and come to our campus and visit us. So today, as I mentioned, I'm talking about chronic diseases. So what are chronic diseases? So chronic diseases are non-communicable diseases. So these are not infectious diseases also. So these diseases happens when we age. For example, there are different chronic diseases that are associated with ages, like osteoporosis, that is bone loss, heart diseases or cardiovascular diseases, arthritis, heartburn, diabetes, cancer, obesity, inflammatory bowel diseases, gout, etc. So why we care about chronic diseases? So it has been estimated that approximately 60% of the population in the world, 60% of the deaths in the world are from chronic diseases, like cardiovascular diseases, diabetes, obesity, etc. And if you see, the blockbuster drugs that are developed against different diseases are for chronic diseases. For example, this is a drug called Humira. So then there is a drug for this is used for autoimmune disorders, and there is another drug, Sovaldi. It is used for hepatitis C. Remicade. It is used for autoimmune diseases. So most of the blockbuster drugs that are developed for the treatment of chronic diseases, and their sale is very, very, very high. And this slide shows the top 10 drugs in the world and its sale in 2014. And if you see about the cancer drugs, there are many best-selling cancer drugs, and it's the revenue that is getting to the pharmaceutical companies are very, very, very high. And these are Avastin, Herceptin, Revlimid, Gleevec, and Alinta, etc. However, if you see the benefit of these drugs, so these are drugs mainly used for the prevention and treatment of chronic diseases, and its sale is very high in the world. However, what are the benefits that we are getting from these drugs? So if you see, this is a paper published in British Medical Journal in 2016. The title of the paper was Cancer Drugs, Survival and Ethics. According to this paper, almost 50% of the drugs approved for the treatment of cancer in last 20 years, they are not effective, or the patients not getting any survival benefit from these drugs. So then, so most of these chemotherapeutic drugs developed as giving less benefit or no benefit to the survival of cancer patients. So this is a very interesting cartoon I saw in Google Images. So the patient came to the doctor and then asked, then the patient had a cancer or some diseases, and the doctor told the patient, see, I have a miracle drug. It extends his survival by 6 to 12 months, but it costs $10,000 a month. Then the patient asked, okay, that's fine, but how long will I survive if I don't take it? So the doctor replied, it is again 6 to 12 months. So that means even though the drugs that has been used or developed and used for the prevention treatment of many chronic diseases, they are very expensive, but those drugs are not giving any benefits to the patients. So now the question is that where this money is going to. The pharmaceutical companies are developing many drugs for the prevention and treatment of chronic diseases. But what they use this money mainly, so they use this money for marketing activities, not for R&D, research and development. So you can see 20% of their margin, they are large companies, they are using for market intelligence. And marketing they are using for 31%, and the global congressman, convention management, and those things they are using for 20%. So this shows that marketing is the main key of this big pharmaceutical companies. So these drugs are very expensive, and these drugs are not giving any survival, providing any survival benefits. And this is another cartoon I saw in Google Images. It's very interesting and it tells the truth. So the patient came to the doctor, and the doctor has given a drug to the patient. And the doctor told it has minor side effects. After a couple of months, the patient came back with a very weird shape and structure, and asked the doctor, you said no side effects, just look at me now. Then the doctor replied, I said minor side effects. You are even though you have these shapes, but you are looking okay too. So these drugs, whatever developed in last 20 to 30 years or 40 years, these drugs they are very expensive. At the same time, they have a lot of side effects. So this is the main problem of the drugs that we are using for chronic diseases. So therefore, it is urgent to find out safe, efficacious, and affordable drugs for the prevention and treatment of chronic diseases. So to find out the main drugs for the prevention and treatment of chronic diseases, we have to first understand what's the main risk factor for chronic diseases. It has been well established that inflammation is the main killer in our body. So you know what is inflammation. So the inflammation is the main killer, and it leads to heart attacks, cancer, Alzheimer's, and other diseases. So this is a cover story published in Times magazine almost 10 years ago. And this is another, very interesting. The whole issue of Science magazine was dedicated to inflammation. And this is published 11th January 2013. In this issue, they have mentioned what is inflammation and what are the different causes of inflammation, what are the different inflammatory mediated diseases, and what are the mechanism of inflammation, and how we can curb inflammation and treat different diseases. So what is inflammation? You feel inflammation as a pain or heat or redness or swelling or loss of function. And this is one picture of an example of inflammation. So, however, there are two types of inflammation: acute inflammation and chronic inflammation. What is acute inflammation? It is a short-term inflammation when some infectious agents come to our body or invade our body. Some stimulus will happen and our immune cells try to kill those infections, and once the infection is over, the stimulus will end. That is what is known as acute inflammation. But what is chronic inflammation? It is, as the name suggests, it is a long-term inflammation. It is an ongoing stimulus, and repetitive cycles of inflammation occurs, and that leads to many other diseases. For example, so you have a kitchen in your house and there is a gas burner. So whenever you want to cook something, you can turn on the gas burner and you can cook rice or you can boil water, and whenever you when it is done, you can turn off this gas burner. Even many times you can control the intensity of the flame. So inflammation means the flame within our body. So you can control it, is like a gas burner. So you can switch it on and switch it off whenever you require. So that is what is known as acute inflammation. However, chronic inflammation means it's an uncontrolled inflammation. Acute inflammation, it's a very controlled inflammation, and chronic inflammation is an uncontrolled inflammation. So what happens if the gas burner bursts? That is what is chronic inflammation. So what are the potential sources of this chronic inflammation? There are many different agents that cause chronic inflammation. These are environmental pollutants, then food factors, bacteria, viruses, cigarette smoke, stress, ultraviolet radiation, alcoholic beverages, etc. are the main sources of inflammation. And there are more than 100 different inflammatory diseases have been discovered in the world. These include bronchitis, inflammation of the bronchus, cervicitis, inflammation of the cervix, colitis, inflammation of the colon, gastritis, inflammation of the stomach, hepatitis, inflammation of the liver, pancreatitis, inflammation of the pancreas, etc. So if the word is a noun and if it ends with itis, that refers to inflammation. And this inflammation can lead to many other different diseases. So, for example, it can lead to cancer, it can lead to neurological diseases like Parkinson's disease, Alzheimer's disease, epilepsy, etc. It can lead to metabolic disease like diabetes, metabolic syndrome, etc. It can lead to bone disease like osteoarthritis, skin disease like wrinkles, cardiovascular disease like atherosclerosis, stroke, heart failure, etc. Then this is one of the book our group published about inflammation, lifestyle, and chronic disease long back. And now inflammation is not good for the body and it leads to many different diseases. So now the question is that how we can extinguish inflammation. So it has been well established that there is a protein or it is a transcription factor. It is called NF-kappa B, and this is the main link between inflammation and chronic diseases. So what is NF-kappa B? It is a transcription factor. So this is the cytoplasm of a cell and this is the nucleus of the cell. So NF-kappa B is a trimer. Trimer means 3 proteins are there. And what are those 3 proteins? This P50, P65 and I-kappa B alpha. So when this I-kappa B alpha is the inhibitor of NF-kappa B. When an activator or stimulus present, this I-kappa B alpha will get phosphorylated. When it gets phosphorylated, it undergo ubiquitination and degradation. So it is an inhibitory molecule of NF-kappa B, as I mentioned. So ubiquitination means it's a meaning is kissing of death. So it degrades that protein. So now what happens? P50 and P65 is free because the inhibitory molecule is not present. Then this P50, P65 goes to the nucleus and binds to the promoter regions of many genes and induce the transcription of these genes. And these genes, there are many genes induced by NF-kappa B. So what are those genes? Different enzymes, different apoptotic regulators, then the proteins involved in antigen presentation, other transcription factors, cell cycle regulators, cell adhesion molecules, different receptors, different viral oncogenes, different cytokines, and acute phase proteins, etc. And so, which is the most potent activator of NF-kappa B? There is a cytokine called tumor necrosis factor alpha. So this is the most potent pro-inflammatory cytokine in the world, and so this tumor necrosis factor alpha induces NF-kappa B, and this NF-kappa B induces different inflammatory genes, and these inflammatory genes cause different diseases like arthritis, asthma, cancer, COPD, cystic fibrosis, diabetes, heart diseases, osteoporosis, etc. So now the question is that NF-kappa B is not good if it is continuously expressed. Then how you can suppress NF-kappa B activation? So there are many drugs that develop that target tumor necrosis factor alpha. For example, Humira and Enacryl. So these are monoclonal antibodies and small molecule inhibitors that target tumor necrosis factor alpha. However, these drugs have a lot of side effects. And this is now is a $20 to $30 billion market, Humira and Enacryl. Not only that, these drugs are very expensive. For example, one dose of Humira, in USA they are using one dose costs $6,000 US. So it is that expensive, and you have to take one injection per month up to 6 months for arthritis. So that means you have to pay around $36,000 US. It is almost equal to 20 to 24 lakhs. So that way you can inhibit NF-kappa B. So, however, as I mentioned, these drugs have a lot of side effects and these are very, very expensive. So it is very interesting. In New York Times in November 2009, there is an article published. So what this article shows, Sloan School of Management at MIT. MIT means Massachusetts Institute of Technology. And the Harvard Business School has created farmers market. So all these pharmaceutical companies are created by these management schools. At the top of these pharmaceutical companies, you can see the people who studied in these big universities, business schools. However, we cannot afford this medication developed by the farmers market. So we need a farmers market which can be affordable to most of the population in the world. So it is going on pharmaceutical versus pharmaceutical. So pharmaceuticals are very expensive and has a lot of side effects, but we need pharmaceuticals that can be used by majority of the population in the world. So let me give an example with some of the most prevalent diseases in India, because most of the drugs developed by these big pharmaceutical companies we cannot afford. So, for example, oral diseases. Oral diseases is a major problem throughout the world. Almost 80 to 90% of the population has oral diseases. So what are the different types of oral diseases? It can be gingivitis, or oral mucositis, or oral erythroplakia, or oral leukoplakia, oral candidiasis, oral lichen planus, periodontitis, dental caries, even oral cancer. These are the different oral diseases. So Now, if you want to develop drugs against these oral diseases, we have to find out what are the main risk factors for these oral diseases. So these are the main risk factors for oral diseases like tobacco chewing, betel quid chewing like Betilla, alcohol, different viruses, then unhealthy diet, different chemicals like asbestos, nickel, wood dust, etc., and ultraviolet light, and poor hygiene, immunosuppression, etc. These are the main risk factors for oral diseases. And it has been already established now, all these risk factors induce the expression of tumor necrosis factor alpha, TNF alpha, then tumor necrosis factor alpha induces NF-kappa B, then it induces different inflammatory genes, and then oral diseases. And later, some of these oral diseases tend onto oral cancer. And that is one of the most prevalent cancer in India. So let me give an example with one of the most common oral diseases. It is called oral submucosal fibrosis or OSMF. So this is oral submucosal fibrosis. So what is that? It is a chronic, insidious, and pre-malignant disease of the oral cavity. And it is characterized by deposition of dense collagen in the connective tissue. Even in its long back, it has been described in Indian manuscript by Susruta. Susruta mentioned this as Vedari. And here the patients suffer from narrowing of the mouth and burning sensation and pain. So it is one of the most common oral diseases in India, and its overall incidence is 0.5%. 0.5% means almost now 1 crore to 2 crores. And it mainly affects the people at the age between 20 to 45 years. So as I mentioned, this oral diseases or oral submucosal fibrosis can develop into oral cancer. It has been established that approximately 25 to 30% of the patients with oral submucosal fibrosis they tend to oral cancer. You can see these are some of the pictures of this oral submucosal fibrosis and oral cancer. So this shows the suppression of OSMF. If we can suppress this oral submucosal fibrosis, that is also a very dangerous disease. But if we can suppress this disease, we can prevent oral cancer, because oral submucosal fibrosis leads to oral cancer. So what are the risk factors of oral submucosal fibrosis? As I mentioned, arachidonic chewing or tobacco chewing, gutka, all these things are the main risk factors of oral submucosal fibrosis. And what is the treatment available? So at present, essentially no treatment available for oral submucosal fibrosis. However, the physicians, they prescribe different kinds of steroids for the like corticosteroid, etc., for the prevention and treatment of OSMF. However, you know the side effects of these steroids very well. So it is not a good therapeutic option. So there are so many papers published in the there are so many publications in the literature which shows that cytokines or inflammation causes oral submucosal fibrosis. For example, this is a paper published in 2005. This paper shows betel quid or arachidonate. They affect the epithelial cells of the oral cavity and induce the expression of different cytokines like IL-6, IL-8, TNF-alpha, GM-CSF, etc., and then induce inflammation, and that leads to fibrosis and other complications. This is another paper published on this line, which shows that cytokine levels and inflammation is very high in oral submucosal fibrosis patients. For example, here you can see TNF-alpha is very high in these patients. The IL-6 is another cytokine, inflammatory cytokine, that is also very high in these patients. IL-8 also very high in these patients. So this is another study that published in 2014, which shows that expression of tumor necrosis factor alpha and its correlation with the severity of oral submucosal fibrosis. So TNF-alpha induces inflammation. Here you can see this is the patients with OSMF, oral submucosal fibrosis. The level of TNF-alpha is at 23.46 picogram per ml. But in normal controls, it is 6.93. So TNF-alpha is expressed approximately 4 times than the normal, healthy individuals in these patients. So not only TNF-alpha, there are many studies that shows NF-kappa B also highly expressed in oral submucosal fibrosis patients. This shows that TNF-alpha and NF-kappa B that induce inflammation and leads to oral submucosal fibrosis. So now we know that TNF-alpha and NF-kappa B is the major culprit for oral submucosal fibrosis. So we have to develop highly safe, efficacious, and affordable TNF-alpha and NF-kappa B inhibitors, and they have high potential in the prevention and treatment of oral submucosal fibrosis. So what are those TNF-alpha and NF-kappa B inhibitors? So you can use steroids, NSAIDs, Celiprax, metformin, statins, etc. for the to curb or to inhibit TNF-alpha and NF-kappa B expression. However, these are all known to have a lot of side effects, and many of them are highly expensive. So what is the solution? Natural products or traditional medicine is the main alternative for the prevention and treatment of oral submucosal fibrosis. So, for example, you may remember the Nobel Prize in Physiology and Medicine in 2015 gone to three people: William C. Campbell, Satoshi Omura, and Yu To. So this Yu To, she discovered or isolated a chemical from a plant, and this is one of the most commonly used anti-malarial drug. That is why she got this Nobel Prize, and that is known as artemisinin. So this artemisinin is isolated from a plant called Artemisia annua, and this is one of the most successful anti-malarial drug used for the treatment of malaria, and that is why they have been awarded the Nobel Prize in Physiology and Medicine in 2015. Another important example is statin. Statins are originally isolated from Chinese red yeast rice. So statins are cholesterol-lowering drugs, and this is used for the prevention and treatment of cardiovascular diseases. So it has been seen that in some population in China, they use this Chinese red yeast rice, and their incidence of cardiovascular disease are very less in those population. So then people started working on that, and they isolated a compound. It is called statin, and that is one of the most commonly used cholesterol-lowering drugs in the world. And approximately the global market of statin is now $20 billion. So this is one of the, so we need to find out TNF-alpha and NF-kappa inhibitors for the prevention treatment of oral submucosal fibrosis and oral diseases. So this is very interesting. There is a paper published in 1995 from our group, inhibition of TNF-alpha by curcumin, a phytochemical. So this shows that curcumin is the most, a compound called curcumin is the most potent inhibitor of TNF-alpha. If you put curcumin in culture, within 2 to 5 minutes, it inhibits TNF-alpha expression in cells. This is published in 1995, and there are so many publications of TNF-alpha and curcumin in the PubMed. It's a database. So approximately it is more than 1100 now. So not only that, in the same year, there is another paper published by our group, which shows that curcumin can inhibit the NF-kappa B expression. So this is also, curcumin is so far the most potent inhibitor of NF-kappa B. And you can see there are more than 1,000 publications in PubMed on curcumin and its suppression of NF-kappa B activation. So what is curcumin? Curcumin is nothing. It is isolated from the plant turmeric or manjal or haldi, and it is the yellow colored compound present in haldi or turmeric. So there are more than 28, 29 compounds isolated from secondary metabolites isolated from turmeric. However, this is the most commonly seen compound in turmeric. So you can see this is the turmeric roots. I don't have to tell you what is turmeric and those things. And this is the yellow colored powder of curcumin. And we have published a lot on curcumin and its activities, biological activities. And this is the molecular targets of curcumin. So curcumin can act on, it is not a mono-target compound, it's a multi-target compound, and it can act on different inflammatory cytokines, different kinases, different receptors, apoptotic regulators, different transcription factors, enzymes, growth factors, etc. And there are so many preclinical studies have been published on the effect of curcumin for the prevention and treatment of oral diseases. I cannot explain each and every study, so I put it in a table format. For example, gingivitis. So these are in vitro and in vivo study, and these are the mechanism of action, and these are the preferences. And another is oral mucositis. So many in vivo studies shows the effect of curcumin on oral mucositis, even periodontitis. Then oral candidiasis, oral mucositis, oral periodontitis. There are so many studies have been published on the effect of curcumin on different oral diseases. So this is not only for different oral diseases. Curcumin's effect has been, shown for the prevention and treatment of oral cancer. So these are some preclinical studies. Preclinical means in vitro, in the laboratory conditions, or in animals. For example, some studies used curcumin in combination with some drugs like cetuximab, geftinib, green tea, paclitaxel, metformin, etc. And most of the studies shows high efficacy of curcumin in vitro and in vivo for the prevention and treatment of oral cancer. So what is the mechanism of action of curcumin for oral diseases? Oral diseases, even though the NF-kappa B is main agent, but it is a multifactorial disease. There are many signaling pathways and proteins are involved in the development of oral diseases, and the major signaling pathway is NF-kappa B. And it is very interesting that curcumin can not only inhibit NF-kappa B activation, and it can inhibit many pathways and proteins that are involved in the development of many oral diseases like ERK signaling pathway, JNK signaling pathway, JAK-STAT signaling pathway, NF-kappa B signaling pathway, AKT signaling pathway, VEGF signaling pathway, TGF signaling pathway, etc. I hope this screen is visible to everybody.
Disappeared.
Yeah, you can see that, right? Different screen mechanism of action of curcumin in oral diseases, right?
Now it is not clear.
Oh, it is not clear?
No. Screen is not seen.
Okay, so I will stop the sharing, and again I will, I will start sharing. Okay.
Okay.
But you could see the slides that I changed, right?
No, sir.
No. Now in between I changed.
Okay.
That was visible, right?
Now coming. Okay.
Now I have changed a lot of slides. Those slides you have seen, right? Understand?
Yeah.
All slides. So now you can see this slide, mechanism of action of curcumin in oral diseases. Am I right?
Okay. Yeah.
So now which slide you are seeing? Preclinical studies of curcumin?
Yes.
Yeah. Okay. Now it's clear. Okay. Fine. Sorry for the disturbance. So mechanism of action of curcumin in oral diseases. So there are so many pathways and the proteins are involved in the development of oral diseases, and curcumin is shown to inhibit or modulate the expression of these signaling pathways and proteins involved in the development of many oral diseases. So we have used many different forms of curcumin for clinical trials. So what are the different forms we used? We used pills. These are 1000 milligram or 1 gram, and capsules 500 milligram, or different lozenges, that is 100 milligram. And you can see this slide also, right? Different forms of curcumin.
Yes, yes.
Yeah, okay, thank you. So this is a very interesting, in 2016, there was one paper published on the efficacy of curcumin. It was a double-blind, placebo-controlled clinical study on oral leukoplakia. This study shows that curcumin has high efficacy in controlling oral leukoplakia. This is one of the oral diseases, and many times oral leukoplakia also tend to oral cancer. So curcumin has shown high efficacy in the treatment of oral leukoplakia. So this is not only oral leukoplakia, curcumin and turmeric has shown high efficacy in the prevention and treatment of oral submucosal fibrosis. For example, this is a paper published in 1997 in Cancer Letters. Effect of turmeric oil, turmeric uracil in patients suffering from oral submucosal fibrosis. So this shows that yes, the turmeric oil has decreased the number of micronucleated cells in oral mucosal cells of oral submucosal fibrosis patients. This is another study published. I'm talking about clinical studies. This is published in 2015. Efficacy of curcumin in the treatment of oral submucosal fibrosis, a randomized clinical trials. So this was a 3-month clinical trials. 18 to 15 years old patients were enrolled in this study, and they have taken 2 grams of curcumin. And the results shows that who are taken the curcumin, they were able to increase the mouth opening compared to the control group. And they had a decreased burning sensation because it's an inflammation, so it induces a lot of burning sensation or pain. So when you take curcumin, it inhibits those. Then there is another study published, a comparative study of the efficacy of curcumin and turmeric oil as chemopreventive agents in oral submucosal fibrosis. This is also a clinical study, and this study shows the patients who are taken curcumin, they have improvement in clinical signs and symptoms of OSM. Then this is another study published 2015. The curcumin they have used with the Thrissur, and it was another clinical study, and it is published from India, and they have shown that the burning sensation and mouth opening was decreased in Thrissur and curcumin treated or turmeric treated group than control group. So this is another study published in 2014 about the effect of turmeric in the management of oral submucosal fibrosis. In this study, they used 300 milligram tablet to patients, and the patients were 21 to 30 years old, and they have seen 85% improvement in the treatment of oral submucosal fibrosis. So I talked to you about steroids. Steroids, even though initially they show some improvement, but after that, the patient suffer a lot of other complications. However, curcumin, it was very safe, and it shows 85% improvement in the signs and symptoms of oral submucosal fibrosis. So these are some of the clinical studies that published, which shows the effect of curcumin and curcuminoids, for different oral diseases like St.Thomas stomatitis, and it shows these are the different oral diseases. These are combination, if they used in combination, or these are the number of patients, whether it is effective or not effective, etc. And these are the references. So, for example, St.Thomas stomatitis, gingivitis, oral erythroplakia, oral leukoplakia, oral mucositis, then oral lichen planus, periodontitis, etc. So these are all different clinical trials. I have seen more than 40 clinical trials on curcumin and different oral diseases, and most of these studies shows high efficacy of this compound. And recently we have published a paper in American Chemical Society, Pharmacology and Translational Science about the effect of curcumin and its on oral diseases. The title was From Simple Mouth Cavities to Complex Oral Mucosal Disorders. Curcuminoids as a promising therapeutic approach. This is one of the most downloaded paper in this journal. And not only for oral diseases and oral cancer. The effect of curcumin has been well studied in patients for different cancers in humans. For example, breast cancer, cervical cancer, colorectal cancer, head and neck cancer, pancreatic cancer, prostate cancer, solid tumors, etc. These are all clinical studies, patient studies, and you can see number of patients and what's the clinical outcome. Most of the studies shows high efficacy of the compound. Not only that, this compound is well tolerated in humans. And these are some of the ongoing clinical trials of curcumin in different cancers. For example, cancer, this colon cancer, endometrial carcinoma, glioblastoma, head and neck carcinoma, etc. If you go through the NIH, National Institute of Health, .gov. It is a website of USA, National Institute of Health. There is a clinical trials. If you see, and there is a search column. If you put the search as curcumin, you can see more than 120 clinical trials are going on the effect of curcumin for different diseases. And most of these clinical trials are abroad and not in India. And not only, cancers, or curcumin can be used for the prevention treatment of other diseases like AIDS, HIV. Curcumin is known to inhibit the viral load in HIV patients. Then it can be used for the treatment of metabolic diseases like diabetes, diabetic neuropathy, etc., and inflammatory bowel diseases, some skin diseases. You can also use curcumin. It is, for example, psoriasis. You can use curcumin, and it is well proved by a study at the University of California at Los Angeles. They showed curcumin is known as the Psoriac gold. They named this curcumin as Psoriac gold because of its high effectiveness. Then it can be also used for cardiovascular disease and neurodegenerative disease, etc. And these are some of the recent clinical trials of curcumin for the prevention and treatment of different diseases. For example, the omega-3 and nano-curcumin effects. So many people have started developing nano-curcumin, different formulations of curcumin for the prevention and treatment of different diseases. This study was against episodic migraine patients, and this study shows that shows high efficacy of curcumin in the prevention, in the treatment of episodic migraine in patients. And this study was published from Turkey. This another study published in 2021, effect of curcumin on severity of functional dyspepsia, a triple-blinded clinical trial. And this study shows that curcumin therapy could be a favorable supplementation in the symptom management of functional dyspepsia. And curcumin can also be used for the efficient eradication of H. pylori in these patients. H. pylori causes stomach ulcers and stomach cancer. So curcumin can be used as an agent to kill H. pylori infection in patients. Then this another study published on the effect of curcumin. This also published in 2021. This study, published. This study shows that curcumin is very effective in the treatment of a non-alcoholic fatty liver disease. This was a double-blind randomized placebo-controlled study. And this study shows that low-dose phospholipid curcumin supplementation each day for 2 months showed significant reduction in hepatic steatosis and enzymes in patients with alcoholic liver diseases compared to placebo. And this is another study published recently on curcumin, and they have used in this study curcumin and boswellia, and this study shows that it is the curcumin is in combination with the boswellia is very effective in maritime pine bark. Then this is another study published. So now it is a COVID time. And many people ask me, so whether we can use curcumin for the prevention and treatment of COVID. So this is the answer for that. And this study published in January 2021. This shows oral nanocurcumin formulation and its efficacy in the management of mild to moderate COVID-19 patients. It is a triple-blinded placebo-controlled clinical trial. So this study shows that all the symptoms except sore throat resolved faster in the treatment group. And the difference was very, very, very significant. Not only that, this CRP serum level was very low in the treatment group. And however, no adverse reaction was reported in the treatment group. This shows that curcumin is very, very effective for the management of COVID-19. Even the effect of curcumin on coronavirus was first, that was a different strain of coronavirus. It was first established in 2008. And there are so many studies in PubMed. If you see more than 150 studies on curcumin and COVID-19, you can see, and many of them are clinical trials. And this is another study published in 28 May 2021, Frontiers in Pharmacology journal. This is one of the prestigious journal. This was from India. Oral curcumin with piping as adjunct therapy for the treatment of COVID-19, a randomized clinical trial, again clinical trials. So this study shows that administration of curcumin as an adjuvant could substantially reduce morbidity and mortality and ease the logistical and supply related burdens on the healthcare system. So curcumin can be used as a safe and natural therapeutic option for the treatment of COVID-19. So, these are a couple of studies I'm talking about curcumin and COVID-19, but there are so many studies published in PubMed and other databases. So if you see I started working on curcumin in 2001. That time there were only 500 publications of curcumin. And it is very, very interesting that even 2005, when I checked it, there was 1,700 publications. But 2017, December 2017, when I searched in PubMed, I got 12,506 publications of curcumin and its efficacy against different diseases. And interestingly, after 2 years, this has been raised to 14,324. That was on 23rd January 2019. And so I had given a talk in 20th August 2021 in an institute near Guwahati. It's a pharmacy institute. So that time when I checked, there were 17,587, that is 15 days ago, publications of curcumin in different diseases in PubMed. And the clinical trials were 385 clinical trial studies, you can see. I saw at that time. However, today when I was checking at 4 o'clock, just 1.5 hours ago, I have seen 17,689, more than 100 publications on curcumin and different diseases in 15 days. So you can imagine how many people are working on this subject, and why they are working on this topic, because of the high efficacy of this compound in the prevention and treatment of different diseases. So 15 days ago, there were 385 clinical trials published. And today, when I checked, 3 more clinical trials were added. So now the total number is 388. It is also interesting that more than 2,000 articles were published in 2020 alone on the effect of curcumin for the prevention and treatment of different diseases. So this topic is very hot now, and many people are started believing the effect of curcumin for the prevention and treatment of different diseases. So health is wealth. All of you know health is wealth, right? That's the most important wealth of ours. So haldi is health. Haldi means turmeric. That is health. So haldi is a wealth. So if you use haldi or turmeric every day, that can prevent many different diseases, even aging also. So this is very interesting. So that may be the reason, many of our rituals we are using turmeric, and many places whenever we have wedding or anything, we use turmeric, right? So this is a turmeric bath in India. And I went to Japan, actually 2018 and 19, and I saw a spa there, and it is called Yukon Spa. Yukon means turmeric in Japan. So what is that spa? So if you give some money, Japanese yen, you can take a bath in turmeric water, like half an hour or 1 hour. That is what is called the Yukon spa, and it is in Japan. So this is called the turmeric temple. It is in Jejuri, Maharashtra. Everything is turmeric there. Even prasada, everything. So you can see from the picture, it is full yellow in color. So these are the different, types of curcumin or turmeric. You can use, products available in the market. These are capsules, cream, gummy, soap, drink, face cream, drinks, soap, candy, etc. And so we use turmeric in different curries, right? So keep on using that, and it would help us a lot in preventing many diseases. So that is why Hippocrates long back mentioned, let food be the medicine and medicine be the food. So food is your medicine, and if you eat junk food, it may lead to many different diseases. However, if you eat healthy food, that is a medicine. That's a proper medicine of you. And this is very interesting. I got it in Daily Hunt News. Haldi in Indian weddings. Why you are using haldi in Indian weddings? So they have pointed out 10 reasons. One is to keep the Bari Nasser away. The color is auspicious yellow color, and it gives an extra glow, and it is an antiseptic, antimicrobial, and it purifies the body. It detoxifies. Curcumin or turmeric is known to detoxify many impurities in your body, and it drives away pre-wedding jitters. Curcumin also used for the depression, and it is also used for wedding preparation. And the yellow is associated with the new beginning and helps the unmarried ones marry soon. That I don't know, but this is seen in Daily Hunt News, and it will help only the unmarried ones, not the married ones. Okay. So, and it is a symbol of blessings. So that is why we are using haldi in Indian weddings. So, so in many places when I give a talk, everybody asks the question, what about the bioavailability of curcumin? So this is a yellow color compound, and it is hydrophobic in nature. So what do you think about the bioavailability, whether it is absorbed by the body? Yes, it is absorbed by the body. We have written many papers on that, and we have did a lot of clinical trials as well as experiments on that. And what we observed that, yes, curcumin is bioavailable, but it depends on the disease, So if you are having, skin diseases, you can topically apply this compound. Or if you have having some disease in your internal body organs, then you have to take orally the compound. So it depends on disease. If it is an inflammatory disease, you may have to use 500 milligram to 1 gram. However, if you have cancer, you have to use a higher dose of curcumin. So it is many times what happens when curcumin enters in your body. So the main barrier is which is hydrophobic. So intestinal villi may not absorb curcumin. That is one barrier. And another thing is that once it's reached in your body, blood, then it goes to the liver, and there is an enzyme in the liver. It is called gluconidase. This gluconidase enzyme converts curcumin to curcumin gluconide, and that's an inactive. So there are many formulations developed to overcome these issues, and these are known as first generation, second generation, and third generation. First generation, what happens? They use some black pepper or piperine. So this piperine is known to inhibit the enzyme gluconidase in the liver. So curcumin will stay more time in the body. Second generation, developed a lot of solubility, formulations to increase the solubility of curcuminoids, because curcumin is hydrophobic. So they were trying to make it hydrophilic. And the third generation addressed the problem of free curcuminates bioavailability and the membrane permeability and cellular uptake, etc. And there are so many formulations of curcumin available nowadays. Even I have been involved in more than development of more than 10 to 15 different curcumin formulations by different pharmaceutical companies. So these are the different formulations of curcumin for better availability, Merriwa, curcumin C3 complex, MP16, liposomal curcumin, Therac curcumin, curcumin mouthwash, Curcufan, BCM95, Phytoprot, etc., or super curcumin you can use for better bioavailability of curcumin. So these are some of the papers we published on this line, non-curcuminoids from turmeric and their potential in cancer therapy and anti-cancer drug delivery formulations. So not only curcumin, there are so many other compounds also present in curcumin, which also gives a lot of biological activities. So, so we are, because of the time limit, I'm not explaining other compounds. There are so many other compounds we are working on to develop drugs for the prevention treatment of different oral disease and oral cancer. And our laboratory was recognized as a DBT unit of excellence in cancer drug discovery. And we are using curcumin and other lot of natural products in developing drugs for oral disease and oral cancer. Where we are working on different compounds like curcumin, boswellic acid, scopolamine, thymoquinone, restorfine, ellagic acid, camphorol, isotenol, quercetin, azadirachtin, even bethaferin also we are working on nowadays for developing drugs for different diseases. Not only that, our laboratory is also recognized as DBT AIST, International Center for Translation and Environmental Research. So this is an Indo-Japan collaboration. So 2017, IIT Guwahati and AIST Japan signed an MOU and inaugurated my laboratory as the joint laboratory of Indo-Japan collaboration. So that was happened in May 8th, 2017, and the main thrust area of this collaboration is development of safe, affordable, and efficacious drugs for oral cancer prevention and treatment. And we are actively working on Japanese counterparts to develop different drugs for the different targets and drugs for the prevention and treatment of different oral disease and oral cancer. And these are some of our publications along this line. So we published a lot on natural products and its effect on different diseases. For example, targets and therapeutic use of spices, modern uses for ancient medicine, anti-cancer properties of fruits and vegetables, scientific review, cancer cell chemoresistance and chemosensitization. There also I have mentioned about different compounds that have been used for the natural compounds used for the prevention and treatment of different cancers. And these are a couple of books we published in 2020 from Royal Society of Chemistry, the chemistry and the bioactive components of turmeric, then inflammation and natural products, etc. And these are my lab team. This is a little bit of old photo. 2 years ago, we had a get together and we took this photo. And many of the students are gone from the lab and they are in different laboratories all over the world, like USA, UK, Japan, Italy, France, Germany, etc. And thank you so much for your patient hearing.
Thank you, sir, for your detailed presentation, explaining in detail the danger of inflammation, the clinical and medical tragedies in the treatment of cancer, clinical trials in the field of medical treatment, along with some studies related to the same, and explained effectiveness of using curcumin, potential of curcumin against the diseases, and even on COVID-19 based on clinical findings. Thank you, sir.
Thank you.
Now I invite Dr. Vimala Jose, the moderator of Day 1 webinar series, Guru Vandana.
So if you have any questions, I'll be very happy to answer.
Hey Ajay,
Yeah.
nice to meet you.
Yeah.
My name is Shiva.
Yeah, I heard about that.
All right.
Yeah.
I just listened to all your talks and
yes.
Big hi to all my teachers there. And
okay. Nice.
Nice to meet all of you in this meeting. And I just it was really interesting to listen to you all these talks and all these progress happening. So I am just being in US when I go to the for example over-the-counter medication and things like that. I don't really see too much curcumin kind of product. Maybe it is there. Some of them you showed in your slide. So my question is, how how near are we to get these compounds, purified compounds in the market, especially by big pharma people for the routine treatments, similar to like metformin and other medicines you mentioned. It looks like it is very promising, looking at the pace at which the publications are coming, like several thousand. Like maybe by the time you finish the talk, we got another 300 added to those publication list for the curcumin. So what is your take on that? Like how far are we, or how close are we to get these components in the market, especially for the treatments, immediate treatments, with better bioavailability, as you mentioned?
Yeah. Thank you, Shiva, for it's a very interesting question. And nice to see you here also. I have heard about a lot of you. Nice. So let me tell a story, small story. So I went to USA in 2005 for postdoc. So we were working on curcumin, and we want some curcumin for some experiments. Okay. So what we did, we told our secretary to send an email to a company in India to get 500 milligram of curcumin. So by mistake, the secretary wrote 500 kilogram, kg, instead of mg, kg. Okay, it's a small mistake, but it's a big mistake also. So what happened, next day we got an email from the company. We cannot give 500 kilogram of curcumin. We can give maximum 4-5 kilo within a couple of weeks. And if you want more, we are talking to other companies, and we can get something around 50 to 60 kilogram in next 3 to 4 months. Okay.
Yeah.
In 2018, the same company exported 2,000 tons of curcumin.
My God, yeah.
Okay, and they got almost 400 to 500 crores that year. So where this curcumin is going to, it's to your place only, most of this curcumin. Okay.
Oh yeah.
And most, even Amway also using curcumin in their formulations. And there are many formulations available, maybe over the counter. You may not see, however, in the online, like Amazon and other, and there are so many companies in USA also work, selling curcumin. I know maybe at least 10 I know. Okay.
Yeah.
So and even Emory, Emory.
Emory,
they are actually cultivating curcumin, and they are saying it's an American curcumin. Do you know that? It's very interesting. So. So curcumin research has gone very well, and it has shown very good activity, no doubt about that. Even so, for the prevention, you don't need formulations of curcumin, because you may need 250 milligram to 500 milligram of curcumin. So in most of the turmeric powder, it is present 3 to 10 milligram. Sorry, 3 to 10%. So and it's very easy to isolate.
Yeah.
Okay, the curcumin. So if you take like 1 gram of turmeric, or 2 gram of turmeric every day, turmeric powder, that is enough. Even I have been using, when I was in USA, I get turmeric powder and put it in water, and I was using, and it helped me a lot for many things.
Oh, good.
Yeah. And talking about the big pharmaceutical companies, when they will do it, that's a big question. Even I don't know. And I believe that they may not do it.
Yeah.
Believe me, because I told you Humira. So that's a monoclonal antibody against TNF-alpha. It is $6,000 per injection. And who will buy who will sell them 1 rupee tablet of curcumin?
That's right.
Because $6,000 they can get a lot of profit, and they don't want to mention about this compound at all.
Yeah.
Because these pharmaceutical companies, they need some compounds, which can be patented so that they can get a lot of money. And that is what is happening to most of the cancer drugs, and you know better than me. So I don't know how long it would take. However, you know, many patients, they are taking curcumin. Even yesterday night, I got a call from a patient, and he was suffering from oral cancer and undergoing radiotherapy and those things. And finally, I recommended him, okay, you use it, and it's up to you. If it is good, you use continuously. That is so. It may take some time, but people start believing. That is why, you know, now India is exporting approximately 4,000 tons of curcumin per year, and India is cultivating. India is producing almost 1 million kilo. I think 1 million tons of turmeric every year. This is what's showing actually, and out of that, 100,000 tons we are exporting to other countries.
Yeah, thank you so much.
You're welcome. Any other questions?
What's the best way to be in touch with you, like email or something? Like
Email
that?
or WhatsApp, anything, no issue at all. You know.
All right.
So let me
If
know.
I have more questions, I will email you.
Sure, no issue at all. Okay, it's a pleasure. Okay.
All right. Thank you.
Yeah, I hope you have my email address and all those things. I will be in touch. Okay, don't worry.
Yeah,
we'll be in touch.
Any questions from audience side? Dr. Ajay, it was very interesting. Actually, that was a wonderful lecture.
Thank you.
And, IIT campus and your team was also very experienced, good experienced as
Okay, thank you.
research scholars.
Thank you. Even Dr. Vimla Miss, there is one student. She also joined, but I'm not seeing now. Maybe some problem in internet connection. So she studied BSc at St. Thomas College, and now she joined in my laboratory, BSc Botany in our department, and joined in my laboratory. So as a JRF, her name is Anjana Saji. So she was here. I'm not able to see now actually.
Oh, Anjana Saji.
Yeah.
She studied BSc here and PG from St. Thomas.
Yes.
She cleared NET JRF last year.
Yeah. And she now joined. Yes, she joined. Couple of weeks ago in my laboratory as a JRF. She's doing very well. Nice.
Any other questions? Actually, this curcumin therapy is traditionally used by Ayurvedic system also, no?
True.
Curcumin and even manjalum, kurumulagum, ചേർത്തിട്ടുള്ള പല preparations are there.
Yes.
In Ayurveda. So,
Yeah.
other than that is traditional Indian drugs. Just like right from birth to death, we are using curcumin.
Yes.
As a part of Indian culture. So even in every occasions, weddings and other ceremonies also we are using.
Yes.
Actually, all this has this thing. No?
Yeah, it has power. That's what I feel. Because if there is no activity, why people are working on that, and 388 publication clinical trials so far published, and another 120 to 150 clinical trials are ongoing. That shows the efficacy of this compound, effect of this compound. And even I use it. Even during the last year when Corona started, I started using this. The COVID started, I started using this curcumin. Not curcumin, is a turmeric. Every day morning, I take 1 teaspoon of turmeric and then put it in water and drink. And I traveled a lot last year and this year also. So far, I'm free from Corona. I didn't get it. Maybe the effect may be due to curcumin. Who knows?
Preventive therapy also, like not only the curing.
Yes. and it is not toxic, so anybody can take it. Only thing, it should be, I don't know, if you buy curcumin as the turmeric powder, how good is that? If you get a good organic turmeric powder, that would be very good to prevent many diseases, including cold, fever, and everything. Even cholesterol also, it decreases. Yeah.
Any doubts and any clarifications required, please ask. Okay, let us wind up then. Thank you, Dr. Ajay sir.
Thank you.
Thank you, audience, for listening, and wish you all the best, Dr. Ajay Kumar, for your future research. Hope to see you again in our campus for a wonderful seminar there. And whenever you visit Thrissur, kindly come to our college and our department. Thank you.
Sure, definitely. Thank you so much.
Thank you, Ms. Now I invite Dr. Anto PV, coordinator of this program, for the vote of thanks.
നന്ദി പറയുന്നതിനേക്കാൾ മുമ്പ് നമ്മുടെ അധ്യാപകരെല്ലാവരും ഒപ്പം നമ്മുടെ ഇൻവൈറ്റഡ് സ്പീക്കേഴ്സും ഒന്ന് വീഡിയോ ഓൺ ആക്കി കഴിഞ്ഞാൽ നമുക്കൊരു സ്ക്രീൻഷോട്ട് എടുക്കാനാണ്. അപ്പൊ എല്ലാ അധ്യാപകരും പിന്നെ നമ്മുടെ ജോസാറും ഉണ്ടാവും എന്ന് ഞാൻ വിചാരിക്കണം. ഇപ്പോഴത്തെ അധ്യാപകരും മുൻ അധ്യാപകരും എല്ലാവരും വീഡിയോ ഓൺ ആക്കുക. ഹലോ, സന്ധ്യ മിസ്സേ, ഹലോ.
ജേക്കബ് സാറും ജോൺ സാറും ഓണാക്കിയിട്ടില്ല.
ഇല്ല, ജേക്കബ് സാറ്, ജോൺ സാറ്, സന്ധ്യ മിസ്സേ ഒരു സ്ക്രീൻഷോട്ട് എടുക്കോ? സനു
സർ,
ഒരു സ്ക്രീൻഷോട്ട് എടുത്ത് വെക്കണം. അടുത്ത ഒരെണ്ണൂടി വേണം. ഓക്കെ, ഇനി മറ്റുള്ള എല്ലാവർക്കും വീഡിയോ ഓൺ ചെയ്യാം. ഹലോ, ഇതിൽ പങ്കെടുക്കുന്ന പാർട്ടിസിപ്പൻസിന് എല്ലാവർക്കും വീഡിയോ ഓൺ ചെയ്യാം. സ്ക്രീൻഷോട്ടിന് വേണ്ടിയിട്ടാണ്. ഓക്കെ, തോമസ് സാറ് വന്നിട്ടുണ്ടോ? ജോബി സാറ്, ഓക്കെ, നമുക്ക് നന്ദി പ്രകടനത്തിലേക്ക് കിടക്കാം. സ്നേഹമുള്ള എന്റെ ഗുരുബോധരെ, എന്റെ ഒപ്പം വർക്ക് ചെയ്യുന്ന അധ്യാപകരെ, ഞാൻ പഠിപ്പിച്ച വിദ്യാർത്ഥികളെ, എന്നെ പഠിപ്പിച്ച് ഈ ലോകം വിട്ടുപോയ എന്റെ പ്രിയ അധ്യാപകരുടെ ബന്ധുമിത്രാദികളെ, ഇന്നത്തെ ഒരു ഗുരുവന്ദനം എന്ന് പറയുന്ന ഒരു പരിപാടി യഥാർത്ഥത്തില് കോളേജിൽ വേണമെങ്കിൽ അത് ആദ്യമായിട്ടാണെന്ന് എനിക്ക് തോന്നുന്നത്. ഒരു ഡിപ്പാർട്ട്മെന്റിലെ മുഴുവൻ മരിച്ചുപോയ എല്ലാ അധ്യാപകരെയും ഓർത്തുകൊണ്ട് അങ്ങനെ ഒരു പരിപാടി സംഘടിപ്പിക്കുന്നത്. ഇതില് എനിക്ക് ഏറെ അഭിമാനത്തോടു കൂടി പറയാനുള്ളത്, ഇതിലെ സ്പീക്കേഴ്സ് ആയിട്ട് വന്ന വ്യക്തികള് നമ്മുടെ അലുമിനിയാണ്. കഴിഞ്ഞ കൊല്ലം കാലിക്കറ്റ് യൂണിവേഴ്സിറ്റിയിലെ ഹെഡ് ഓഫ് ദി ഡിപ്പാർട്ട്മെന്റ് ആയിട്ടുള്ള ജോസ് സാർ എന്നോട് പറഞ്ഞു, ഇപ്പോഴത്തെ 3 പേരെ വെച്ച് കഴിഞ്ഞ കൊല്ലം എന്നോട് ഈ പരിപാടി നടത്താൻ പറഞ്ഞായിരുന്നു. പക്ഷെ എനിക്കത് നടത്താൻ സാധിക്കാതെ പോയി. സെയിം ടോപ്പിക്കാണ് ആൾ നിർദ്ദേശിച്ച് തന്നെയാണ് ഇപ്രാവശ്യം നമ്മൾ നടത്തുന്നത്. ഇപ്രാവശ്യം അജയ് സാറാണ് മുൻകൈ എടുത്തിട്ട് വന്നത്, നമുക്കിത് നടത്തണം എന്ന് പറഞ്ഞിട്ട്. അങ്ങനെ ഈ പ്രോഗ്രാം വൻ വിജയമാക്കാനായിട്ട് പരിശ്രമിച്ച എന്റെ അധ്യാപകര്, ഒപ്പം പൂർവ്വ വിദ്യാർത്ഥികള്, ഒപ്പം ഞാൻ പഠിപ്പിച്ച വിദ്യാർത്ഥികള്, അവർക്കൊക്കെ ഏറെ സ്നേഹത്തോടു കൂടി ഞാൻ നന്ദി പറയുന്നു. ഞാൻ ഇന്ന് നോക്കിയപ്പോഴേ, ഞാൻ ഇന്ന് വളരെ ഈ ഇരിക്കുന്ന സമയത്ത് ഞാനൊന്നൊരു കാര്യം ശ്രദ്ധിക്കായിരുന്നു. ഞാനൊരു 3 തലമുറയിൽപ്പെട്ട അധ്യാപകരായിട്ട് കോണ്ടാക്ട് വരുത്താനായിട്ട് എനിക്ക് സാധിച്ചു. എന്നെ പഠിപ്പിച്ച 13 അധ്യാപകരിൽ 12 പേര് എന്നെ പഠിപ്പിച്ചിട്ടുണ്ട്. അബ്രാം സാർ മാത്രമേ പഠിപ്പിക്കാത്തുള്ളൂ. ED വർഗീസ് സാറ്, ജോൺ സാറ്, കെ.പി. ജോൺ സാറ്, CL ജോസ് സാറ്, TJ തോമസ് സാറ്, E ജോസ് സാറ്, NV ജോസഫ് സാറ്, CK ജോൺ സാറ്, KM ജെയിംസ് സാറ്, ടോണി ജേക്കബ് സാറ്, ജേക്കബ് സാറ്, CD വർഗീസ് സാറ്, ഇഗ്നീഷ്യസ് ആന്നി സാറ്, ഇത്രയും പേര് എന്നെ പഠിപ്പിച്ചിട്ടുള്ള അധ്യാപകര്, കൂടാതെ ഇപ്പൊ ഉള്ള ആറ് അധ്യാപകര്, അങ്ങനെ എനിക്ക് തോന്നുന്ന ഒരു 3 തലമുറയിൽപ്പെട്ട അധ്യാപകരെ കണ്ടുമുട്ടാനുള്ള ഒരു ഭാഗ്യം എനിക്ക് സിദ്ധിച്ചു എന്നുള്ളത് ഞാൻ ഏറെ സ്നേഹത്തോടു കൂടി നിങ്ങളെ അറിയിക്കുകയാണ്. അതിന് ഞാൻ ദൈവത്തോട് നന്ദി പറയാണ്. നമ്മൾ പഠിപ്പിച്ചു വിട്ട വിദ്യാർത്ഥികള് വൻ പൊസിഷനിൽ എത്തി എന്ന് പറയുമ്പോൾ തന്നെ നമുക്ക് ഏറെ അഭിമാനമാണ്. ഇന്നലെ ഞാൻ തോമസ് സാറിന്റെ വീട്ടിൽ പോയിരുന്നു. തോമസ് സാറിനോട് ഞാൻ വീഡിയോ ചോദിച്ചിരുന്നു ആശംസകൾ പറഞ്ഞിട്ട് തരാനായിട്ട്. അപ്പൊ സാറ് ആദ്യം തരില്ല എന്നാണ് എന്നോട് പറഞ്ഞത്. എന്നോടല്ല, ഞാൻ വായിച്ചൊരു സ്റ്റുഡന്റിനോട് പറഞ്ഞത്. പിന്നെ ഞാൻ വിളിച്ചപ്പോ സാറ് പറഞ്ഞു ഞാൻ എന്താ ചെയ്യേണ്ടതെന്ന് ചോദിച്ചു. അങ്ങനെ എന്നോട് അങ്ങോട്ട് വരാൻ പറഞ്ഞു. എനിക്കതൊരു കിട്ടിയൊരു അംഗീകാരമായിട്ട് ഞാൻ കരുതുന്നു. സാറ് വിളിച്ചു വരുത്തി അവിടെ വെച്ച് വീഡിയോ എടുത്തു, ഞാൻ പോരും ചെയ്തു. വളരെ സ്നേഹത്തോട് എന്നെ പടി വരെ കൊണ്ടുവന്നാക്കിയിട്ടാണ് സാറ് പോയത്. അപ്പോ അത് ഒരു ഏറെ അംഗീകാരമായിട്ട് ഞാൻ കരുതുന്നു. ഈ പ്രോഗ്രാമിന്റെ ഒരു പ്രത്യേകത എന്ന് പറയുന്നത് ഈ തുടക്കത്തിലുള്ളവർക്ക് എനിക്ക് ഭയങ്കര സന്തോഷവും കണ്ണിന്ന് വെള്ളമൊക്കെ വന്നൊരു സമയമായിരുന്നു. കാരണം എന്നെ പഠിപ്പിച്ച എല്ലാ അധ്യാപകരും ഒരു പ്ലാറ്റ്ഫോമിൽ ഒരുമിച്ച് വന്നിട്ട് വർത്താനം പറഞ്ഞത് എനിക്ക് വളരെ 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 സന്തോഷം തോന്നി. ഇതിലുള്ള എല്ലാവർക്കും ഒരു പക്ഷെ അങ്ങനെ തോന്നിയിട്ടുണ്ടാവാമെന്ന് ഞാൻ വിചാരിക്കുന്നു. ഇങ്ങനൊരു അവസരം ഒരുക്കാൻ സാധിച്ചതിൽ എനിക്ക് ഏറെ സന്തോഷമുണ്ട്. ഒപ്പം തന്നെ എന്നോട് പറഞ്ഞിരിക്കുന്ന ഒരു കാര്യം നന്ദി പറയാനാണ്. പക്ഷെ ഞാൻ നമ്മുടെ ഡിപ്പാർട്ട്മെന്റിന്റെ ഒരു കാര്യം കൂടി നിങ്ങളെ ഓർമ്മപ്പെടുത്താണ്. നമ്മുടെ ഡിപ്പാർട്ട്മെന്റിൽ പഠിപ്പിക്കുന്ന എല്ലാ അധ്യാപകർക്കും ഇപ്പൊ PhD ഉള്ള അധ്യാപകരാണ്. യഥാർത്ഥത്തിൽ എല്ലാ അധ്യാപകർക്കും PhD ഉണ്ട്. നമ്മളൊരു റിസർച്ച് സെന്റർ ആയിട്ട് ഉയർത്തിയിട്ട് 19 കുട്ടികൾ അവിടെ റിസർച്ച് നടത്തുന്ന ഒരു ഡിപ്പാർട്ട്മെന്റ് ആയിട്ട് നമുക്ക് ഉയരാനായിട്ട് സാധിച്ചിട്ടുണ്ട്. ഇതില് തുടർന്നുള്ള ഒരു അച്ചീവ്മെന്റ്സിന് നമ്മുടെ പൂർവ്വ വിദ്യാർത്ഥികളുടെയൊക്കെ സഹായവും സഹകരണവും ഒക്കെ നമുക്ക് ആവശ്യമുണ്ടെന്നുള്ള കാര്യം ഞാൻ ഉദ്ബോധിപ്പിക്കുന്നു. ഇന്ന് അവതരിപ്പിച്ച ഒരു ടോപ്പിക് ഫൈറ്റോകെമിക്കൽ ഫോർ ദ പ്രിവെൻഷൻ ഓഫ് ട്രീറ്റ്മെന്റ് ഓഫ് ക്രോണിക് ഡിസീസസ്. അത് വളരെ മനോഹരമായിട്ടാണ് നമ്മുടെ അജയ് സാർ അവതരിപ്പിച്ചത്. അത് എനിക്ക് ഇതിനു മുന്നേ ഞാൻ സാറിന്റെ ക്ലാസ് കേട്ടിട്ടുണ്ട്. അതുകൊണ്ട് ഇതിന്റെ എല്ലാ പ്രത്യേകതകളും അന്ന് പറഞ്ഞ ഒരു മേഖലയിൽ നിന്ന് വിട്ടിട്ട് ഇന്നൊക്കെയാണ് ഓറൽ ഡിസീസുമായി ബന്ധപ്പെട്ട ഒരു മേഖലയിലേക്ക് കോൺസെൻട്രേറ്റ് ചെയ്യാണ് സാർ ചെയ്തത്. അന്ന് പറഞ്ഞത് ശരിക്കൊരു ക്യാൻസറിനെ എങ്ങനെ പ്രിവെന്റ് ചെയ്യാനുള്ള കേപ്പാബി മെക്കാനിസത്തെ പറ്റിയിട്ടാണ് അന്ന് നമ്മളോട് സംസാരിച്ചിട്ടുണ്ടായിരുന്നത്. അതിന് വ്യത്യസ്തമായിട്ടുള്ള ഒരു മേഖലയിലേക്ക് ഇന്ന് എത്തിച്ചേരാനായിട്ട് സാധിച്ചു. ഇന്ന് ഇവിടെ വേറൊരു പ്രത്യേകത കൂടി ഞാൻ നിങ്ങളുടെ മുന്നിൽ അവതരിപ്പിക്കുന്നത് എന്താണെന്ന് വെച്ച് കഴിഞ്ഞാൽ, നമ്മുടെ 3 അധ്യാപകര്, മരിച്ചുപോയ അധ്യാപകര്, എനിക്ക് തോന്നുന്നു ജെയിംസ് സാറിന്റെ ഭാര്യ ടീച്ചർ ഉഷ ടീച്ചർ ഇതിൽ ജോയിൻ ചെയ്തിട്ടുണ്ട്. ടീച്ചറുടെ തുടക്കത്തില് ഞാനിത് ഓൺലൈനായിട്ട് ഈ പ്ലാറ്റ്ഫോം തുറന്ന വശം ജോയിൻ ചെയ്ത ആൾക്കാർ 2 പേര്, ഒന്ന് CK ജോൺ സാറും അബ്രഹാം സാറുമാണ് ഏറ്റവും ആദ്യം. പിന്നെ അജയ് സാറ് വന്നു. അപ്പോ എനിക്ക് വളരെ സന്തോഷം തോന്നി. കാരണം നമ്മൾ പ്രതീക്ഷിച്ചത് ഇവരൊക്കെ എത്തിച്ചേരുന്ന തന്നെയാണ്. അത് കണ്ടതിൽ എനിക്ക് വളരെയേറെ സ്നേഹത്തോടെ ഞാൻ അവരോടൊക്കെ നന്ദി പറയാണ്. ഇനി നമ്മുടെ നന്ദി പറയുന്ന ചടങ്ങിലേക്ക് കടക്കാം. അതിന് മുമ്പ് വിട്ടുപോയൊരു കാര്യം, ജെയിംസ് സാറിന്റെ കാര്യം മാത്രമേ പറഞ്ഞുള്ളൂ. CL ജോസ് സാറിന്റെ കുടുംബം ഇതിൽ പങ്കെടുത്തിട്ടുണ്ടാവും നമ്മൾ അറിയിച്ചിട്ടുണ്ടായിരുന്നു. അതേപോലെ ED വർഗീസ് സാറിന്റെ കുടുംബത്തിൽ പങ്കെടുത്തിട്ടുണ്ടാവും ഞാൻ വിചാരിക്കുന്നു. അവര് നമ്മൾക്ക് നൽകിയിട്ടുള്ള കുറെ പാഠങ്ങൾ, ഇപ്പൊ ജെയിംസ് സാറിനെ പറ്റിയിട്ട് അജയ് സാറ് കുറെ കാര്യങ്ങൾ പറഞ്ഞു. എനിക്കും അതേപോലെ തോളോട് തോൾ നിന്നിട്ട് പ്രവർത്തിച്ച കുറെ മേഖലകൾ ജെയിംസ് സാറായിട്ട് എനിക്കും ഉണ്ട്. CL ജോസ് സാർ എന്നെ പഠിപ്പിച്ച അധ്യാപകനാണ്. ഞാൻ MSc പഠിക്കുന്ന കാലഘട്ടത്തിൽ ആൾ ഹെഡ് ഓഫ് ദ ഡിപ്പാർട്ട്മെന്റ് ആയിരുന്നു. അതിനുശേഷം എനിക്കാണ് തോമസ് സാറിന്റെയും കൂടി ഒരു കാലഘട്ടത്തിൽ കഴിഞ്ഞിട്ടാണ് ഞാൻ MSc കഴിഞ്ഞ് പോന്നിരിക്കുന്നതെന്ന് എനിക്ക് തോന്നുന്നത്. പിന്നെ നമ്മുടെ ED വർഗീസ് സാറ്, ഞാൻ പ്രീ ഡിഗ്രിക്ക് ഉള്ളപ്പോഴാണ്, ഡിഗ്രി ഫസ്റ്റ് ഇയർ ഉള്ളപ്പോഴും മാത്രമേ സാർ ഉണ്ടായിട്ടുള്ളൂ. അതിനുശേഷം സാർ റിട്ടയർ ചെയ്തിട്ടുണ്ട്. അപ്പൊ ഈ 3 മഹനീയ വ്യക്തികളെ നമ്മൾ ആദരിക്കുന്നു. അതോടൊപ്പം എന്നോട് തോമസ് സാറിന്റെ അടുത്ത് ചെന്നപ്പോ ആള് പറഞ്ഞു, പൗലോ സാർ എന്ന് പറഞ്ഞൊരു സാറ് ഇതേപോലെ നമ്മുടെ കോളേജിൽ വർക്ക് ചെയ്തിട്ടുള്ള ആളാണ്, നിങ്ങൾ എന്താ സ്മരിക്കാത്തതെന്നൊക്കെ എന്നോട് ചോദിച്ചു. അപ്പൊ എനിക്ക് പറയാനുള്ളത്, നമ്മൾ ആരും വിട്ടുപോകുന്നതല്ല, എല്ലാവരും നമ്മൾ സ്മരിക്കാൻ ഒരു ദിവസം കണ്ടെത്തുന്നുണ്ടെന്നുള്ള ഒരു ഉറപ്പും കൂടി ഞാൻ നിങ്ങൾക്ക് തരികയാണ്. ഇന്നത്തെ നമ്മുടെ ഈ പ്രോഗ്രാം ഉദ്ഘാടനം ചെയ്യാൻ എത്തിച്ചേർന്നത് നമ്മുടെ പ്രിൻസിപ്പാളായിട്ടുള്ള മാർട്ടിനച്ചനാണ്. മാർട്ടിനച്ചൻ എന്ന് നിങ്ങൾ എപ്പോഴും പറയുന്നതെന്ന് വെച്ചാൽ, ഞങ്ങൾക്ക് ഏറ്റവും പ്രിയപ്പെട്ടും ഞങ്ങളുടെ ബർസാറായിട്ട് ഇരുന്നിട്ടുള്ള ഒരു വ്യക്തി പിന്നീട് പ്രിൻസിപ്പാൾ തസ്തികയിലേക്ക് ഉയർത്തപ്പെട്ടതാണ്. അപ്പോ അച്ഛനെ ഏറെ സ്നേഹത്തോടു കൂടി ഇന്നലെ കാലത്ത് ഞാൻ കണ്ടപ്പോൾ അച്ഛൻ പറഞ്ഞു ഞാൻ എന്തായാലും വരും, ആൾ താമസിക്കുന്ന സ്ഥലത്താണ് റേഞ്ച് ഇല്ലാത്തതുകൊണ്ടുള്ള ഒരു പ്രോബ്ലം വന്നതുകൊണ്ടാണ് വീഡിയോ ഓൺ ചെയ്യാതെ അച്ഛൻ സംസാരിച്ചത്. എന്തായാലും അച്ഛനെ ഏറെ സ്നേഹത്തോടു ഈ ബോട്ടണി ഡിപ്പാർട്ട്മെന്റിന്റെ പേരില് നന്ദി രേഖപ്പെടുത്തുന്നു. അതേപോലെ നമ്മുടെ ഇന്നത്തെ പ്രോഗ്രാമത്തിന് സ്വാഗതം ആശംസിച്ചത് വിമല മിസ്സാണ്. ഒപ്പം മോഡറേറ്റർ ആയിട്ട് വർക്ക് ചെയ്തു. മിസ്സിനെ ഏറെ സ്നേഹത്തോടു കൂടി ഡിപ്പാർട്ട്മെന്റിന്റെ പേരില് എന്റെ പേരിലും ഈ പ്രോഗ്രാമിന്റെ പേരിലും ഏറെ സ്നേഹത്തോടു കൂടി ഞാൻ നന്ദി രേഖപ്പെടുത്തുന്നു. നമ്മുടെ മുഖ്യ അതിഥിയായിട്ട് ഇവിടെ എത്തിച്ചേർന്ന അബ്രാം സാറാണ്. തന്റെ ആവശ്യകതകളൊക്കെ മറന്നുകൊണ്ട് സാറിനോട് പറയുമ്പോഴേക്കും സാറിന്റെ വീഡിയോ നമുക്ക് ജേക്കബ് സാർ അയച്ചു തന്നു. ഈ പ്രോഗ്രാമിൽ തുടക്കം മുതൽ പങ്കെടുത്തു സാറ്. സാറിന്റെ ആ സന്തോഷം നമ്മൾ അറിയിക്കുകയും ചെയ്തു. സാറിന് ഞങ്ങളുടെ ഹൃദയം നിറഞ്ഞ സ്നേഹാശംസകളും നന്ദിയും രേഖപ്പെടുത്തുന്നു. ഇനി നമ്മൾ ജോസ് സാറാണ്. ജോസ് സാറ് ഞാൻ ഇങ്ങനെ ഓരോ ദിവസത്തെ ഓരോ അധ്യാപകരെ ഏൽപ്പിച്ചപ്പോ അവരത് സന്തോഷപൂർവ്വം ഏറ്റെടുത്തു. അതിൽ ജോസ് സാർക്കാണ് നമ്മുടെ കെ.എം. ജെയിംസ് സാറിനെ പറ്റി പറയാനായിട്ട് കൊടുത്തത്. സാറ് വളരെ മനോഹരമായിട്ട് ഓർമ്മകളിൽ നിന്ന് അത് അവതരിപ്പിച്ചു. ഇന്നത്തെ ഒരു റിമംബറൻസ് സ്പീച്ച് വളരെ മനോഹരമായിരുന്നു. സാറിന് ഏറെ സ്നേഹത്തോടു കൂടി ഞാൻ നന്ദി രേഖപ്പെടുത്തുന്നു. അതുപോലെ അജയ് സാറിനെ പറ്റിയിട്ടാണ് എനിക്ക് പറയാനുള്ളത്. നമ്മുടെ ഏത് ആവശ്യങ്ങൾ ഉന്നയിച്ചാലും അതിനെ അനുഭാവപൂർവ്വം അദ്ദേഹം അത് ഏറ്റെടുക്കുകയും നമുക്ക് വേണ്ട കരുതലും സ്നേഹവും സപ്പോർട്ടും തരികയും ചെയ്യുന്ന അജയ് കുമാർ സാറ് ഈ പ്രാവശ്യം നമുക്ക് ഒരു അനുസ്മരണ സമ്മേളനത്തോടനുബന്ധിച്ച് വെബിനാറിനോടനുബന്ധിച്ച് നമുക്ക് നടത്തിയ ക്യാൻസറിന്റെ പ്രിവെന്റീവ് മെത്തേഡിനെ പറ്റി വളരെ വിശദമായിട്ട് നമ്മളോട് സംസാരിച്ചു. സാറിനെ ഏറെ സ്നേഹത്തോടു കൂടി ഞാൻ ഈ ഡിപ്പാർട്ട്മെന്റിന് ഈ കോളേജിന്റെ പേരുള്ള നന്ദി രേഖപ്പെടുത്തുന്നു. ഒപ്പം ഇതിൽ കൂടെ ഇപ്പൊ ഇന്ന് നമ്മുടെ ശിവകുമാർ പട്ടത്തിൽ ഇവിടെ എത്തിച്ചേർന്നിട്ടുണ്ട്. സാറിന് നാളെ ക്ലാസ് അവതരിപ്പിക്കേണ്ടതാണ്. സാറിന് ഏറെ സ്നേഹത്തോടു കൂടി ഇവിടെ വന്ന് നന്ദി രേഖപ്പെടുത്തുന്നു. എന്റെ അധ്യാപകരായിട്ടുള്ള CK ജോൺ സാർ വന്നിട്ടുണ്ട്. അതേപോലെ ജോസ് സാർ വന്നിട്ടുണ്ട്. ടോണി ജേക്കബ് സാർ ഇവിടെ എത്തിച്ചേർന്നിട്ടുണ്ട്. ജേക്കബ് അബ്രഹാം സാർ വന്നിട്ട്, ഇഗ്നേഷ്യസ് ആന്റണി സാർ വന്നിട്ടുണ്ട്. ഇവരൊക്കെ ഏറെ സ്നേഹത്തോടു കൂടി ഞാൻ ഓർക്കുന്നു. അവർക്കെല്ലാം ഞാൻ നന്ദി രേഖപ്പെടുത്തുകയും ചെയ്യുന്നു. ഒപ്പം നമ്മുടെ ഈ ക്ഷണം സ്വീകരിച്ച് ഇവിടെ എത്തിച്ചേർന്ന അനവധി കോളേജുകളിലെ അധ്യാപകരുണ്ട്, വിദ്യാർത്ഥികളുണ്ട്. നമ്മുടെ സെമിനാറുകൾക്ക് ചുക്കം പിടിക്കാറ് MS വിദ്യാർത്ഥികളാണ്. അവർക്ക് നാളെ പരീക്ഷ ആയതുകൊണ്ട് പലർക്കും ഇതിൽ പങ്കെടുക്കാനായിട്ട് കഴിഞ്ഞിട്ടില്ല. നാളെ പരീക്ഷ ആയതുകൊണ്ട് അവരുടെ പഠനത്തിന്റെ ഒരു മേഖലയിലാണെങ്കിൽ പ്രാർത്ഥനയൊക്കെ അവതരിപ്പിച്ച പാർവതീനെ ഞാൻ പ്രത്യേകം ഓർക്കുന്നു. അത് സ്റ്റുഡൻസ് കോ കൺവീനറായിട്ട് നമ്മുടെ കൂടെ വർക്ക് ചെയ്യുന്ന വിദ്യാർത്ഥികളാണ്. ഏത് കാര്യം അവരെ ഏൽപ്പിച്ചു കഴിഞ്ഞാൽ ഇതിന്റെ ബ്രോഷറൊക്കെ തയ്യാറാക്കിയത് എൽസ എന്ന് പറഞ്ഞൊരു കുട്ടിയാണ്. അവരൊക്കെ ഏറെ സ്നേഹത്തോടുകൂടി ഓർക്കുന്നു. ഇതിനുള്ള എല്ലാ സജ്ജീകരണങ്ങളും ഒരുക്കി തരുന്നത് MS വിദ്യാർത്ഥികളാണ്. അവരോട് ഏറെ സ്നേഹത്തോടു കൂടി ഞാൻ നന്ദി പറയുന്നു. കഴിഞ്ഞ MSc ബാച്ചിൽ വിദ്യാർത്ഥികളാണ് ഇത് അവതരിപ്പിക്കുന്നത്. സംയുക്ത അതിന്റെ പ്രതിനിധികളാണ്. അതിൽ വളരെ പേര് ഇതിൽ പങ്കെടുത്തിട്ടുണ്ട്. അവരെ ഇനി ഞാൻ ഏറെ സ്നേഹത്തോടു കൂടി നന്ദി പറയുന്നു. നമ്മുടെ ഈ പ്രോഗ്രാം യൂട്യൂബ് ലൈവായിട്ട് നമുക്ക് ഇപ്പൊ നടന്നുകൊണ്ടിരിക്കുന്നുണ്ട്. അത് ചെയ്യുന്നത് നമ്മുടെ കോളേജിലെ ജസ്വിനാണ്. അപ്പൊ ജസ്വിൻ എന്നോട് പറഞ്ഞു ഒരു കാര്യം പഠിക്കേണ്ട സാറ് ഇതെപ്പോ നോക്കിയാലും നമുക്ക് ഈ കോളേജിന്റെ വെബ്സൈറ്റിൽ നമുക്ക് അവൈലബിൾ ആയിരിക്കും. അതിനു വേണ്ടിയിട്ട് ഈ ഞായറാഴ്ച ദിവസവും വളരെ ബുദ്ധിമുട്ടിയിട്ട് നമ്മുടെ ഒപ്പം ഇത്ര സമയം ചെലവഴിച്ച ജസ്വിനെ ഏറെ സ്നേഹത്തോടു കൂടി ഞാൻ നന്ദി പറയുന്നു. ഇനി ഒരുപാട് വ്യക്തികൾക്ക് എനിക്ക് നന്ദി പറയാനായിട്ടുണ്ട്. കാരണം ഇതിന് സജ്ജീകരണങ്ങളൊക്കെ ഒരുക്കി തന്ന അധ്യാപകരുണ്ട്. ഒപ്പം 2-3 കാര്യം കൂടി നമ്മൾ വെളിപ്പെടുത്താണ്. ഇഗ്നേഷ് സാറിന്റെ ഒരു പ്രത്യേകത. ഇഗ്നേഷ് സാർ ഈ പ്രോഗ്രാം ആരംഭിക്കുമ്പോൾ തന്നെ എല്ലാ സപ്പോർട്ടും നമുക്ക് തന്നിട്ടുണ്ടായിരുന്നു. ഇതിന്റെ ഏതൊക്കെ രീതിയിൽ അറേഞ്ച് ചെയ്യണം ആ കാര്യങ്ങൾ നമുക്ക് നിർദ്ദേശങ്ങളൊക്കെ തന്നിട്ടുണ്ടായിരുന്നു. ഈ ഇതിനോടനുബന്ധിച്ച് നമ്മളൊരു പേപ്പർ കോമ്പറ്റീഷൻ മത്സരം നടത്തിയിട്ടുണ്ട്. അതിനു വേണ്ടിയിട്ടുള്ള പൈസ അദ്ദേഹമാണ് സ്പോൺസർ ചെയ്ത് പറഞ്ഞ് കുറെ കാര്യങ്ങൾക്ക് മുന്നിൽ നിന്ന് നയിക്കാനായിട്ട് സാറ് എപ്പോഴും നമ്മുടെ കൂടെ ഉണ്ടായിരുന്നു. ഇന്ന് നമ്മുടെ ഈ പ്രോഗ്രാമുകളിൽ മുൻപന്തിയിലെ ഏറെ നേരം അദ്ദേഹം ഉണ്ടായിരുന്നു. പിന്നീട് എന്തോ സൗകര്യം മൂലം ഇപ്പോ ആള് ലെഫ്റ്റ് ചെയ്തു എന്ന് എനിക്ക് തോന്നുന്നു. അതേപോലെ ഇനി നമുക്ക് നന്ദി പറയേണ്ട കുറെ അധികം വ്യക്തികളുണ്ട്. നമ്മുടെ കോളേജിൽ പഠിച്ചുപോയ കുറെ കുട്ടികൾ, OSAയുടെ പ്രതിനിധികള്, ഇഷ്ടംപോലെ ആളുകൾ ഈ ഇതിൽ പങ്കെടുത്തുകൊണ്ടിരിക്കുന്നുണ്ട്. എനിക്ക് അവരൊക്കെ എൻട്രി ചെയ്തുകൊണ്ട് എനിക്ക് എല്ലാവരെയും പറ്റി അറിയാം. എല്ലാവരോടും ഏറെ സ്നേഹത്തോടെ. ടോണി സാറ് എനിക്ക് വേണേ, ടോണി സാറ് ഇപ്പോഴും ലെഫ്റ്റ് ചെയ്തിട്ടില്ല എന്നാണ് എന്റെ ഓർമ്മ. പക്ഷെ ആള് വീഡിയോ ഓൺ ആക്കി ചെയ്തിട്ടില്ല. ടോണി സാറിനെ പ്രത്യേകം ഞാൻ അഭിനന്ദിക്കുന്നു. ഇതില് വരികയും നമ്മുടെ ഒപ്പം ഈ പ്രോഗ്രാമിൽ പങ്കെടുക്കുകയൊക്കെ ചെയ്തതിന് എല്ലാ വിദ്യാർത്ഥികളോടും വോയിസ് പ്രതിനിധികളോടും ഒപ്പം ബാച്ച്മേറ്റ് ആയിട്ട് നമ്മുടെ കോളേജിലെ വോയിസിൽ വർക്ക് ചെയ്യും അവരെയൊക്കെ അറിയിക്കുകയും അവരെയൊക്കെ കൊണ്ടുവരാനൊക്കെ പരിശ്രമിച്ച എല്ലാ നല്ല വ്യക്തികളോടും ഏറെ സ്നേഹത്തോടു കൂടി ഞാൻ നന്ദി രേഖപ്പെടുത്തുന്നു. ഇനി ആർക്കെങ്കിലും ഞാൻ വിട്ടുപോയിട്ടുള്ളത് എന്റെ സ്റ്റാഫ് അംഗങ്ങൾക്കാണ്, കോ വർക്കേഴ്സിനാണ്. അവര് എന്റെ കൂടെ എല്ലാ കാര്യങ്ങളും എല്ലാ പ്രോഗ്രാമുകളും ഓരോരുത്തർ ഏറ്റെടുത്തിട്ടാണ് ഓരോ ദിവസം സ്വാഗതം ഒരാളാണെങ്കിൽ നന്ദി വേറൊരാൾ അങ്ങനെ മാറിയിട്ടാണ് ഇത് അവതരിപ്പിക്കപ്പെടുന്നത്. അവരോട് എല്ലാവരോടും ഏറെ സ്നേഹത്തോടു കൂടി ഞാൻ നന്ദി രേഖപ്പെടുത്തുന്നു. എല്ലാവർക്കും ഒരിക്കൽ കൂടി നന്ദി രേഖപ്പെടുത്തിക്കൊണ്ട് ഞാൻ നിർത്തുന്നു. നന്ദി, നമസ്കാരം. താങ്ക് യു. നമ്മുടെ ഉഷ ടീച്ചർ ഇതിലുണ്ടോ? ഉഷ ടീച്ചറെ, ഹലോ. ജെയിംസ് സാറിന്റെ ഭാര്യ ഉഷ ടീച്ചർ ഇതിലുണ്ടോ? ഹലോ.
ടീച്ചർ ആദ്യം ഉണ്ടായിരുന്നു, പിന്നെ
ലെഫ്റ്റ് ചെയ്തിട്ടില്ല എന്നാ എന്റെ ഓർമ്മ. ലെഫ്റ്റ് ചെയ്തിട്ടില്ല എന്നാണ് എനിക്ക് തോന്നുന്നത്. പോണത് കണ്ടില്ലേ ഞാൻ. ഓക്കെ, ഇനി സാർമാർക്ക് എന്തെങ്കിലും. ഹലോ ജോയ് സാറേ.
ഹലോ, KK Jacob here.
ജസ്വിനെ. ഓക്കെ, ജസ്വിൻ യൂട്യൂബ് സ്റ്റോപ്പ് ചെയ്തോട്ടാ.
Okay.